You know, when I'm thinking about going to a doctor, to tell you the truth, it doesn't cross my mind whether it's a female doctor or a male doctor, but Dr. Angela DeRosa says, you know what, if you're a woman, it should cross your mind. Doctor, it is so good to have you back with us.
Awesome
and
to be
an
here.
early happy Valentine's Day.
Thank you. It's going to be our 3-year anniversary.
Yes, I know. And my
Don't tell
wife,
Duffy.
No, she already knows. She's got the day marked. Threaten Dr. DeRosa. All right, so you're a doctor. Do you really believe that some male medical doctors possibly could be killing you?
Well, I think all doctors could possibly be killing you, male or female. And the big question is, when you look at hormonal health, a lot of doctors are jaded. I don't care if you're male or female. It's just we tend to make the assumption that doctors know what they're doing when it comes to hormones. And if they don't, they may be slowly killing you because they're treating the symptoms of hormone deficiencies with all kinds of medications that you probably don't need.
But is it primarily because they're guys, or is it because medical schools are failing in that area?
Oh, I think medical schools are failing. The media is failing us tremendously. Actually, the International Menopause Society is actually threatening a lawsuit against the media and here locally for the women's health investigators who launched a terrible study and scared women to death about hormones and doctors to death about hormones. And they were wrong. The study was misinterpreted. They actually did a mea culpa 9 years later, and nobody even talked about it.
Is there really an international menopause society?
Is.
Honest to God, on a Friday, you're not kidding me. If there's breaking news, do they call it a flash?
They call it a hot flash.
Man.
But
All right, are you suggesting then that women are better off going to female doctors?
I am not suggesting that. They need to go to doctors that understand hormonal health and that are not going to placate their symptoms. There is nothing more offensive, in my opinion, to have someone pat me on the head and say, there, sweetheart, you need more sleep, more rest, less stress, a date night, and that's patronizing.
Right, and be good to your husband, whatever it is that he says. Right. I just was reading about a guy who's in somebody's state legislature, I don't remember what state, it's just a state I don't want to go to, I know, whose firm belief is that women should submit to their husbands and husbands should be in charge of every decision that the family makes.
I'm going to bite my tongue really hard on that one.
Yeah, I would suggest you not go to your office for help.
No.
What about HRT, hormone replacement therapy? I've heard you call it bunk.
Well, hormone replacement therapy is not bunk. The studies related to them are bunk. When you look at the huge study that came out in 2002, they basically said they're killing women, that 26% increase in breast cancer, causing heart attacks and strokes.
So we did shows on that.
But when you actually look at the true data, when they corrected the statistics, at worst case, it's neutral risk for breast cancer, and best case, it decreased the risk by 23%. Where was the media screaming that from the rooftops? And hormone therapy can prevent not only the symptoms, hot flashes, night sweats, but also testosterone helps glucose metabolism, prevents prediabetes, diabetes, stroke, cardiovascular disease. Thyroid hormone replacement can help prevent cholesterol issues. So again, more risk for cardiovascular disease in events. But what they're doing is they're so fearful of hormones, which when done properly, bioidentical, non-oral, are safe, decrease risk and also decrease the risk of developing chronic illnesses, and keeps us off the medications that are killing us.
Is women's medicine just simply years behind men's medicine?
Well, when you look at women's health here in the United States, we are about a century behind the rest of the world. I just came from an international meeting overseas, and their data is much more progressive. It's actually talking about great hormone uses overall for men and women. And when you look at the reason behind that, most studies here in the United States are paid for by Big Pharma. They don't largely do that outside of the U.S. It's paid for by university grants and research, so they're not biased.
Are there some meds that are being prescribed regularly for women that are harmful?
Yes. One of the most harmful medications for women is low-dose estrogen birth control pills.
Well, you certainly got everybody's attention with that one.
And not to say that birth control pills are bad, but the way they process through the liver kicks out clotting factors, which is a problem. But the biggest thing they do is they bind up free testosterone, which lowers libido. Yes, birth control pills do cause weight gain, decreases our ability to process sugar, which then can lead to inflammation as well as weight gain and prediabetes. But then you make it a low estrogen pill. Now you're going to create all the estrogen deficiency symptoms. And what they don't tell you is low estrogen means high progesterone, which causes weight gain, fatigue, bloating, and an inflammatory state in the body, which can increase your risk for a heart attack and
See,
stroke.
if only we weren't limited for time, if only we had an unlimited amount of time, like around
2 hours.
January the 30th. No, I mean, for example, on January the 30th, I'm free, and a whole lot of people are free. Where can they find you?
They can find us on January 30th. We're doing a hormonal happy hour at Twisted Rose. We're going to have wine tasting. I love it. And we're going to have women talking about love and libido. And actually, we're doing the preview of my new book, which is called How Your Doctor is Slowly Killing You, a women's health survival guide.
There's a lot of guys who just heard love, libido, and wine.
And happy hour.
and they're invited too.
Oh, absolutely.
Right?
It's not excluded for men, but there's going to be a large majority of women. So if you're a single guy, it might be a great opportunity for you.
All right, but do you find that women do respond differently to education, medical advice, whole variety of things if there's a man around?
No, I think women tend to be more proactive about their health care. We can kind of drown that chitter chatter out.
Well, just about everybody that I know that practices medicine says to get a guy into the practice for a physical or something like that, just general care, you have to have a woman pushing him through the door.
In my practice, that's almost essential. We look at women, we started largely in our practice 100% women, now we're a 60-40 blend, and those 40% of men got into our office because their women pushed them in.
Why? Why is that?
Well, largely because their women started feeling better, and they were having an increase in libido and energy, and now they couldn't keep up with their partners anymore. So we got the males in, and they wanted to say, hey, I got to keep up with my wife now. But also, women tend to be the pushers of the men anyways, because God knows they're not going to go see a doctor unless they're dying.
Well, will you keep concentrating on women keeping up with men, wine, libido, and love? What is that date again?
January 30th.
All right, I think probably you'll be able to find out how it is that you can find Dr. Angela DeRosa, and if she's not there the next day after the 30th, you can always find her at her office or here on the Morning Scramble.